do not leave the sessions early. You might miss something or disturb somebody that they want to hear what they're talking about. We'd also appreciate you to turn off your cell phones and your beepers. And don't forget about being a member of the Desert Diabetes Club. It's only $25 a year. And today, you get a free lunch. Otherwise, lunch is $5 if you want to eat lunch with us today. I am very honored to introduce this speaker because he is one of the co-founders, or the founder, of the Desert Diabetes Club here at Eisenhower Medical Center. I don't know, I won't say how many years ago, but a long time ago, maybe 20 years. Dr. John Deller is a magna cum laude Phi Beta Kappa graduate of the University of Pittsburgh. He received his postgraduate training at Walter Reed Army Medical Center in Washington, D.C., and the University of California, San Francisco. After spending 20 years in the U.S. Army Medical Corps, he received his rank of colonel and served as the chief of medicine at the U.S. Military Academy in West Point, New York. He came to Eisenhower Medical Center in 1977 as Director of Education and Research, and has been in private practice for 25 years here in the Coachella Valley. Dr. Deller also served as Medical Director of the Diabetes Program for 12 years. Dr. Deller has authored more than 65 scientific papers and conducted seminars at sea on the subject of healthy lifestyles and has written 2 books on this subject. He co-hosted the weekly TV show Doctor Talk for 5 years. And I would like to welcome Dr. John Deller with the title Conquering Diabetes Epidemic. Would you please welcome Dr. Deller?
Thank you, Melinda. I'm old-fashioned enough that I don't use PowerPoint and slides, so I just have one poster, and it will be revealed shortly. I'd like to start by telling you that in the last decade, we have made great advances in the advancement of diabetes management. We have been able to develop new drugs which target specifically the causes of type 2 diabetes. These drugs can target the beta cells which make insulin, target the fat cells which are important in insulin resistance. We have developed new varieties of insulins which give us better control. We have also developed ways of monitoring diabetes continuously so that patients can have better control. All of these new innovations, however, have been directed primarily at the treatment of diabetes, and something has been missing. That something is we have been neglecting prevention. So my talk today is not going to be about what we're doing for diabetes. It's going to be about what we're not doing. What we're not doing is recognizing that this disease can be prevented, and we're not taking proper action to prevent it. Therefore, since the terrorist alert signals have been dropped from the color coding system, I'm going today to adopt the system that they have dropped, and we're going to give you a red alert for the epidemic of type 2 diabetes. Voila! A little bit of historical perspective here. If you look at the graph, and it's in your handout as well, if you look at the graph on front of the podium, you'll see almost a horizontal line that goes back to 1960 up through 1990, because that's the slow progression of the number of new cases of type 2 diabetes. Then you see in 1990 a sudden rise, almost a perpendicular rise in the incidence of type 2 diabetes. And let me just review the exact statistics here. Back in 1970, there were about 4 million Americans with type 2 diabetes. By 1990, it had increased a little bit to 7 million people in America with type 2 diabetes. about 625,000 new cases each year. In January of 2000, that had jumped to 16 million, the beginning of the upstroke on that curve. And by 2005, there were 21 million new cases. That is 3 times the number in 1990. In 2008, it had gone again to 24 million people, and today there's over 26 million Americans with type 2 diabetes. This is about 1,500,000 new cases each year. So since the turn of the century, the annual increases in new cases of diabetes has reached epidemic proportions, and nobody will deny that. And while it poses a tremendous public health problem, we have done very little to try and conquer this disease. With the current trajectory, and listen to this carefully, with the current trajectory, by 2020, that's less than 9 years from today, if nothing is done to curb this epidemic, 50% of American adults will be either pre-diabetic or diabetic. 50% in just the next 10 years. And we have not gone without warning for this. I'd like to give you just a couple of headlines in the past decade that indicate that we were aware that this epidemic was upon us, and we have done very little to do anything about it. In the early part of the decade, 2 great studies were done, one in Finland and one in the United States, called the Diabetes Prevention Programs. And these studies prove that you can prevent type 2 diabetes. The studies were designed that a number of patients, large numbers of patients with type 2 pre-diabetes, which is a fasting blood sugar between 100 and 125, were divided into 2 groups. One group was the controls. These patients were simply followed for the next 3 years with no intervention. The other group were the ones who were intervened. These are people that were given instructions into weight reduction, proper diet, exercise, lifestyle changes. The lifestyle changes were not dramatic, but it impressed the people in that group, and the group with the lifestyle changes, 58% decrease in progressing to type 2 diabetes over the next 3 years compared to the controls. More importantly, in the United States, an almost an identical study showed again 58% of people failed to progress to type 2 diabetes by lifestyle interventions. Now, what's even more important is that a follow-up on this group who did not progress to type 2 diabetes 10 years later, and just recently reported, showed that still these people who were just followed after that 3 years of intervention with no further intervention, 35% still have not progressed to diabetes compared to the ones who are in the control group. This is called the legacy effect. By planting the seed and having patients see success by not progressing to diabetes, it lasts for a long time. Just think if those patients who were put in that group were also provided with a medication who would add another significant drug and will continue on a medication and lifestyle changes and monitored for the next 10 years, probably very few would have progressed to type 2 diabetes. Well, despite this, not much has been done to curb this epidemic, as you can see by this curve, and it's still progressing. In early 2002, a headline came out that said the feds have endorsed pre-diabetes screening. A report from the Washington Health and Human Services said that they now were recommending screening for all overweight people over the age of 45. A little late, don't you think? Most of the people will have had their diabetes by then. And they were also going to consider screening younger people who might be at risk without telling people who were at risk. Health and Human Services also plan to endorse community support programs and a national program to spread the prevention message. How many of you have heard of this? The ADA, who's